Federal officials recently announced new rules for the Trusted Exchange Framework and Common Agreement. That's big news for HEDIS and for data interoperability. On this episode of Quality Matters, two NCQA experts explain what it all means. This is Andy Reynolds. I'm joined today by Amol Vyas, NCQA Vice President of Interoperability, and Eric Musser, NCQA Vice President of Federal Affairs. Amol, you're here to share some news that TEFCA, that is the Trusted Exchange Framework and Common Agreement, has issued new standard operating procedures, that is, for exchanging data. Remind us, please, what is TEFCA? How should we think about TEFCA?
TEFCA stands for Trusted Exchange Framework and Common Agreement. Essentially, TEFCA is a national health information network.
Some people say TEFCA is like the Postal Service. How so?
Imagine TEFCA as the United States Postal Service for healthcare data. You would get that USPS approved package, send it in through the USPS network, and you have reasonable guarantees that package would be received the same way that you would like it to be received. That's very similar to what TEFCA has done. The USPS system is not mandatory. It is voluntary. It is up to you if you want to use it. The same thing applies to TEFCA. The idea is to make TEFCA as valuable as possible to the participants that want to bring their data exchange needs to that network.
On August 6th, TEFCA issued new SOPs, or standard operating procedures, that are important for qualified health information networks, or QHINs, and other participants engaging in TEFCA activities. What do you think we should know?
Think about QHINs as top-level nodes connected to each other as you think about the network, unfolding across the nation. You have participants choosing to join whatever QHIN is convenient for them. That's how network coverage rolls out to the nation. And what the TEFCA and ONC have done is to recognize HEDIS as an important use case, meriting its own healthcare operations exchange purpose. This basically recognizes HEDIS as a business use case under which organizations can do B2B data exchanges. The HEDIS use case can leverage trusted exchange frameworks, standards-based data sharing, as well as industry-leading standards for HEDIS data exchange. This is one of the high-value scenarios where we expect interoperability to contribute to reduce burden and reduce cost.
TEFCA supports 6 level 1 exchange purposes, and these are big things like treatment, payment, public health, healthcare operations. And the news is that just under that level 1, HEDIS has now been designated as a level 2 exchange purpose. It seems extraordinary to me that TEFCA's level 1 activities are such important things, such as payment, healthcare operations. And here we have HEDIS among the first operations, just one rank lower than things like treatment and payment. Is that as big a deal as it would seem?
I agree. HEDIS is one of the first products endorsed by TEFCA to be an exchange purpose. We have the federal government recognizing that as an exchange purpose that stands on its own because it reduces burden for health IT organizations. We have the honor of the federal government recognizing HEDIS as an established exchange purpose that will bring burden reduction and TEFCA adoption to the market.
Say more about burden and burden reduction, please. How does this news connect to NCQA's interest in burden reduction?
Yeah, burden reduction is a very important focus here. You hear about burden reduction around prior authorization. There is burden associated with gathering data for HEDIS reporting or the primary source verification part of the HEDIS audit. TEFCA could be a vehicle for minimizing technical hurdles and mitigating burden in cases like prior authorization or HEDIS reporting, and it provides the opportunity for NCQA to support not just this burden reduction, but also remove manual processes, reducing burden further.
18 months from now, because of this new standard operating procedure, things are going to change for participants in the TEFCA network. Let's imagine that I work at a health plan. How is my life going to change 18 months from now?
Any organization that wants to send HEDIS exchange data will be guaranteed to have its data packet recognized and forwarded to the destination without anyone in the middle saying that I do not know this exchange purpose. In other words, they can't just say we don't understand this and we drop it on the floor. Anyone that's connected to the TEFCA network will need to understand the HEDIS use case. Right now, some of the network parts may not know or may not have implemented the processing and recognition of that HEDIS exchange. After February 6th of 2026, you will have that guarantee that the whole TEFCA network will recognize the HEDIS reporting exchange. That would be a turning point for HEDIS reporting data exchanges where they will find guaranteed support within the TEFCA network.
I asked other people at NCQA for their perspective.
Hi, I'm Eric Musser. I'm the Vice President of Federal Affairs at NCQA.
Eric, from a public policy perspective, why do the new TEFCA standard operating procedures matter?
TEFCA is a bipartisan policy created under the Cures Act in 2016. And now in 2024, we're feeling that maturation of the policy in real time. We're seeing the convergence of the industry and regulators to say, we're not going to be able to do this alone, and we're not going to be able to do it with a heavy hand. We need to do it through consensus-based frameworks and common agreements. And what's great is people come to the table voluntarily and say, economies of scale. TEFCA at its heart is really freeing up healthcare data to take care of people and populations, but doing it in a timely and consensus-based manner where we care about privacy protections and we're not allowing that Wild West. It's deliberate, it's timed, and it's bringing everyone to the table to say, this doesn't have to be rushed, but it does have to be right.
What do you find that most public policy professionals don't understand or get wrong about digital quality, interoperability, et cetera?
People in policy are often focused on a singular use case. Sometimes they get caught up on the system today, specifically on TEFCA. People, they don't understand what it really is, that it's some big-handed mandate coming down, and it's really not that. It is a call from Congress, from the people over nearly a decade ago, that we need to create a common language around interoperability. And TEFCA will allow us to implement it in a way where everyone's voice comes to the table, where the willing are able to say, we can figure this out.
In speaking with Amol and Eric, I kept hearing the same word over and over. See if you hear it too.
What TEFCA is, it is voluntary.
The fundamental thing to note is the 21st Century Cures Act required that TEFCA be rolled out, but it's also required it to be voluntary, as organizations are not required to be part of TEFCA. Participation is voluntary. So the value of TEFCA, like I said, TEFCA is voluntary.
What's the significance of TEFCA being voluntary?
TEFCA is voluntary, so it has to sell itself. The feedback the industry has been giving the federal government is to make TEFCA attractive to join. It is a slam dunk for organizations wanting to do standardized data exchange, especially given the requirements and the infrastructure that it includes. You're guaranteed to get standards-based data.
Besides TEFCA being voluntary, what's another big idea that frames or explains TEFCA? In other words, what is this really about?
Public-private partnership. The only idea, because it's such a large investment from government and industry, is public-private partnership. Nothing this big can get done with regulation alone or industry alone. The stars seem to be aligning, and the convergence of policy and technology seem to be humming. You see in the policy world requests for how might CMS implement the TEFCA framework into their quality payment programs or into public reporting for the CDC. This TEFCA framework is a whole government approach, and they're thinking that, well, how can this advance interoperability in healthcare and have to provide oversight for it?
What advice would you have for anyone interested in what you've shared with us today?
The best way to get involved or understand more would be to look into NCQA's Bulk Fire Quality Coalition, especially provider organizations or health plan organizations or networks or information exchanges that are looking to be part of the distributed scalability. Joining the Bulk Fire Quality Coalition should tick a variety of boxes as far as your strategy. Number one would be moving to FHIR, which is the next generation interoperability standard. It will also check the box for operationalizing the exchange of data with your partners. But I can think of one checkbox that can rule it all, which is to get stakeholder commitment for your interoperability efforts. Frequently, business and technology are kind of in their own silos. But this Bulk Fire Coalition real-world testing can get alignment within your own organization. And so definitely look at the Bulk Fire Quality Coalition.
Eric, what should we focus on regarding TEFCA for the next 18 months until the new standard operating procedures take effect?
18 months is a good opportunity for people to think about what this means and what conversations they need to have. It allows for people to think about using the TEFCA networks, those new data pipes, for getting data that could be used for HEDIS reporting.
What other advice do you have?
What I don't want people to overstep is that just because we've created these networks, that we can trust that the data is reliable. Data quality needs to be at the forefront, because we might get to a place where we're overwhelmed by the amount of data. We need to be mindful that just because networks are there doesn't mean data flowing through them are reliable. That's the work to be done. We look forward to that next step of making sure TEFCA is a success, that people can feel that the data that's flowing through it is reliable. At the end of the day, it's the efficiencies that patients need to feel from not providing the same paperwork at every appointment to not getting bombarded with messages or explanations of benefits or prior authorizations. We have a great opportunity with this framework. We've seen this convergence of policy and practicality, and folks are coming to the table to make it happen. I think TEFCA has kind of been the underdog in health policy for a while now. Value-based care, patient safety, whole person care, all those things are really salient topics that are brought up a lot. I think TEFCA is about to have its moment, and I'm excited to see it come to greater fruition. I'm really happy to see all the progress we've made, and it's going to take a full government, full industry approach to make this work for people. And I think we're well on our way.
That's well said. Let's leave it there. Amol Vyas, NCQA Vice President of Interoperability. Eric Musser, NCQA Vice President of Federal Affairs. Thank you for explaining all of this to us on Quality Matters.
Thank you.
Thanks, Andy. Great talking to you as always.
Thank you for listening to Quality Matters. You can always learn more at ncqa.org. And be sure to subscribe to Quality Matters wherever you get your podcasts. We'll see you next time.